I realized, I can't do anything.
The pain was excruciating.
And everything that I did caused pain. Sitting was painful.
I couldn't take it anymore. It was a hard time standing.
He's young, not even close to 50 years old yet, but he could barely move.
Always in and out of cars a lot, sitting up and down, going to meetings, sometimes standing for long periods of time.
Meet with FEMA tomorrow.
Bensalem Police Chief Fred Herron isn't the only 40-something getting a hip replacement these days, a surgery that used to be more common for somebody 20 to 30 years older.
He had bone-on-bone arthritis,
making his left leg a bit shorter and walking a lot slower and more painful.
At age 45, I was very young to have this done.
That was Karen Child's first hip replacement 15 years ago. This artisan bakery owner just got her left hip replaced too.
That made me feel old. It made me feel like I was getting old way before my time.
She had wear of the plastic.
What's worse, she needed a redo on the first one.
There's an eccentricity to the head that's off to the side. It's no longer equidistant between the two sides of the socket.
He didn't perform Karen's original hip surgery, but Dr. Matt Austin of Rothman Institute at Jefferson did her redo and others.
Bone loss, where she has bone loss from the plastic wear that occurred in her original hip replacement, which was done in 1998. These were older plastics that didn't have the same wear resistance that the newer plastics today have.
Karen's now walking around on 2 different hip models. No need to start from scratch.
And the liner she received will hopefully last her for the rest of her life. The bearing surfaces have improved substantially since the original replacement she had in '98.
But it's not an easy do-over for a growing number of people having major problems with metal-on-metal hip replacements.
They fail because they've had metal-on-metal reactions, or people have had allergic reactions.
From the cobalt and chromium.
And that would cause what we call pseudotumors. It's not a cancer, but it's a large fluid collection that can cause a significant amount of pain, and there could also be some death of the muscle surrounding the hip. The chief has titanium, he has polyethylene, and he has cobalt chrome.
He has no worries for now. Back on the job just 12 days after surgery. Rehab took 6 weeks. So no longer one leg longer than the other.
That is correct.
I could care less about a little scar. I don't wear Speedos anyway.
Still, no guarantee he won't need a do-over in his lifetime.
I really wouldn't want to do the surgery again, but if I had to do it on my right side, I certainly would.
And after all that Karen's been through.
I mean, the first week is tough, like with any operation is tough, but beyond that, you feel so much better. You feel like you can kind of conquer the world again, and you feel like you're your age, your appropriate age.